Is Madison Weinshank, and during this presentation, I will be explaining the history, purpose, and impact of the American Public Health Association in the United States. The American Public Health Association, also known as APHA, was founded in 1872 by Dr. Stephen Smith and a group of other physicians. Smith was a physician and attorney who served as commissioner of the New York City Metropolitan Health Board and recognized the need in America for a nationwide professional organization that focused on engaging scientists and educating the country on the importance of public health. In very broad terms, the APHA was focused on improving the health of all U.S. residents through education and government policies. It is also important to keep in mind that during this significant time period, new scientific advancements were being developed that helped discover the cause behind communicable diseases, which was useful in improving public health. Since their establishment 149 years ago, the APHA has helped with tuberculosis and infectious diseases outbreaks, water pollution, food safety, sanitation methods, personal hygiene, and even the standardization of health data. Since 1999, the APHA headquarters has been located in Washington, D.C. The organization consists of 54 affiliates, one in each state with additional ones in Northern and Southern California, New York City, and metropolitan Washington, D.C. The affiliates were associated with the APHA, but they run independently with individualized policies and procedures. The affiliates are important because they allow the voice of public health to be communicated at state and local levels. The organization consists of over 25,000 professional members, containing a 250-member governing council, 21-member executive board, and current president Jose Ramon Fernandez Pena, who work together to influence federal policies that will benefit the public's health. The APHA's vision is to create the healthiest nation in one generation. With this in mind, the APHA's current mission statement is to improve the health of the public and achieve equity in health status. The organization realized that even though our nation spends more on healthcare than any other nation, we ranked last among 11 other developed countries based on access to doctors, quality of care, and healthy living. The APHA aims to change our low ranking to the use of developing educational programs and policies based off of professional research. The APHA heavily enforces science-based advocacy and programs for their mission towards health reform. The APHA has 3 overarching values in their organization: science, action, and health. Their work for science includes yearly meetings of public health professionals to discuss the latest research and the best practices. The APHA also publishes a research journal called the American Journal of Public Health and a monthly newspaper, The Nation's Health. Their work for action focuses on providing a collective voice that will advocate at the federal level for scientific-based policies and also funding for public health programs. The APHA hopes that concrete scientific evidence will help address the social determinants in the healthcare system. The APHA also provides educational opportunities for medical professionals through trainings and webinars. Their work for health embraces the goal of accessible healthcare to everyone in every community. The APHA also helps establish a healthcare network between people outside of the public healthcare community. This includes transportation systems and helping kids complete high school. The APHA believes that children who are taught good health behaviors starting in kindergarten and who end up graduating high school will be on track towards a lifetime of better health and economic opportunities. The APHA also tries to prevent infectious diseases from occurring with the promotion of vaccine-preventable diseases. This slide shows the numerous issues that the APHA focus on to improve public health. One of the important issues that the APHA focus on is preventing chronic diseases in Americans. The APHA supports the CDC's Partnerships to Improve Community Health program that focuses on evidence-based methods to reduce chronic diseases and improve public health. The APHA also works with the American Planning Association to form the Plan for Health project that establishes coalitions that aim towards healthier nutrition and physical activity choices. Another important issue includes the APHA's prevention of the spread of COVID-19. The APHA strongly enforces vaccination and tells the community to encourage others to as well. The APHA also presents resources directly from the CDC about COVID itself and information regarding vaccines and the use of masks. It is important to mention that the APHA is a 501c3 organization, meaning that it is allowed federal tax exemption of nonprofit organizations. The organization also relies on taxpayer-funded lobbying, where funds that come directly or indirectly from taxpayers is used for political lobbying. The APHA also accepts donations. Here are my sources, and that concludes the end of my presentation. Thank you for listening.